Good afternoon. My name is Егорская Анастасия. I'm a sixth-year medical student of pediatric faculty of Приволжский Research Medical University. I'm very passionate about endocrinology, so it's an honor for me to present you this Nizhny Novgorod innovation, insulin pills for patients with diabetes. Diabetes is a chronic metabolic disease which is characterized by the increase of levels of blood glucose. This leads to severe damage to the heart, blood vessels, eyes, kidneys, and nerves. 1 in 10 adults are living with diabetes all over the world. Almost half are undiagnosed. Diabetes is a global killer as there dies one patient every 5 seconds. This disease also causes a huge financial burden to any country. Diabetic patients are in constant need for insulin to maintain normal blood glucose levels. Nowadays, there are more than 100 types of insulin products. However, all these products come in the form of subcutaneous injections. And this is not only a painful way of insulin administration, but it is also associated with many complications and a number of negative consequences, such as lipoatrophy and lipohypertrophy at the injection site, local allergic reactions, itching, and so on. Moreover, long-term drug injection brings great physical and psychological burden to diabetic patients, as for some of them it might feel uncomfortable to give themselves injections when being in the public. This is why this Russian, in particular Nizhny Novgorod innovation, is a revolutionary breakthrough. Our scientists from Lobachevsky University have received a patent to create a special nanocomposition for oral insulin delivery. They have created a specific composition which has 4 layers. In the center, there are nanospheres of gold, 3 to 5 nanometers in size. They are then coated with a layer of chitosan for additional stabilization. Chitosan is a specific substance which is received from crab's skeleton. It is widely used in medicine to produce wound healing, hemostatic, and anti-tumor purposes. A chitosan level is followed by an insulin level. An insulin is applied in the form of nanosphere dispersion. It is then coated with another layer of chitosan for better stabilization. Therefore, it's a stable structure for oral insulin delivery. There were conducted laboratory trials on lab animals. This gold chitosan nanoconstruction was shown to increase time of insulin effect, prolonged reduction in blood glucose level, increased safety and biocompatibility, as well as reduced toxicity. Clearly, scientists all over the world are aiming at creating an insulin pill. For example, Yale researchers are working on a nanocomposition with bile acids being a nanocarrier for insulin. University of British Columbia is in the preclinical phase with their potential pill with insulin, which works when being placed behind the cheeks. Massachusetts Institute has come up with a specific capsule for oral insulin delivery, which yet contains a very tiny needle for insulin stomach injection. Also, although a number of non-clinical data have been reported, the clinical progress of oral nanoinsulin technology has not been satisfied due to the difficulty of delivering proteins and insulin orally so far. In addition, the preparation process of oral insulin is still complicated, which is not conducive to cost-effective commercial production. There is little data on the storage stability of these preparations. In conclusion, I would like to emphasize that oral insulin delivery is ideal to prevent injection-negative complications. It is comfortable, physiological, and safe for patients with diabetes. Nizhny Novgorod scientist experiment is therefore hoped to be a success. It is expected to continue once financial support is provided. Thank you for your attention.